48 in the morning, you know, the big deadline is this weekend. If you miss it, it can cost you a bundle.
That's right. We're talking about the open enrollment deadline for healthcare, and a lot of people have questions about it and how all of this works.
Yeah, Sean Holcomb is here. She's from our partners at Humana to tell us about an event in Detroit that can help people understand what they need to do, having insurance so critical.
Yes.
How are you?
I'm well, thanks.
Good to have you with us.
Yes,
we put you over there on purpose, not because we don't love you, but we've got some graphics, and we know you're going to quiz us in a minute. So.
That's right. I'm ready for you.
Right.
All right.
So healthcare is important, but it's also mandatory, right?
That's correct. Absolutely. You know, you have a certain amount of time that you're able to make your decision, and we're in that time period right now.
Yeah, I mean, it's a countdown to what, the 29th of January?
Well, we'll see. I've got questions for you on that.
Okay, that's one of the, oh, sorry. Wow, she's tough like Steve Harvey. Be careful. All right, so to better understand these rules, we've got this game, and you're going to ask us questions. I have no idea what you're asking. I just know that there are 3 answers for each one, right?
That's right, and 3 questions.
Okay.
So you ready to roll?
Well, let's do it.
All right, let's start with the deadline to sign up. The very first question.
Okay.
Is it tomorrow, January 29th? Saturday, January 30th, or Sunday, January 31st?
Ooh, well, it should be right up to the February 1st, but I guess it depends on when you all are working.
Right. Or, I don't know. I'm going to say January 31st. That's my guess.
That's the official deadline, so I'll go with that.
All right, final answer. January 31st is correct.
Oh,
whoa, nice.
All right.
Wait, there's a new car in this for somebody. Okay. Oh, do some more.
Good stuff. Okay.
You know, I think even more importantly, 11:59 p.m. on January 31st.
Okay.
But don't wait. Get out there. Those are decisions you need to be making now and lots of information to gather.
All right.
All right, next one. What is the penalty for not having health insurance? Is it up to $295? $495 or $695?
I don't know, because as I mentioned, I heard a rumor that it's based on your income. So how can it be a flat number if it's based on your income? Or is that just a rumor?
Well, let's look at this as for an individual, okay? So for the individual amount, you know, you are looking at $695 for an adult.
Stop it.
Per adult, $347.50 for a kid. So if you're looking at a family of 4, the penalty can be as much as $2,000 at a minimum.
Wow.
You know, and if you're looking at insurance, and it can be really affordable, many times under $100 per month for families.
The whole family?
That there are plans out there.
Supplemental
if you're getting help, that's exactly right.
Okay.
But it's affordable, and it's important to get out there, get those options, get in contact with an agent, come visit us at our events, because $100 per month is a lot less than $2,000 at tax time.
And if you go past this January 31st deadline, there's not just a penalty. I mean, that's enough, but then you just can't get it.
That's correct.
Right?
Yeah. Barring certain circumstances where you have a significant change in your life or daily events, job change, things like that. But yeah, the window closes, and then there's no door opening on the other side.
Until next year.
Until next year, correct.
Wow, okay. So let's talk about tax credits.
Okay.
Nearly 80% of people in Michigan who signed up for insurance through the marketplace qualified for tax credits. So after the tax credits, how does that work?
Well, the tax credits, you know, a lot of people don't really even know that term. Tax credits is about getting financial help from the federal government to pay for those premiums at the time that you're paying for the premiums, right? So yeah, you have about 80% of folks are out there, and there is a certain percentage that are actually, I mentioned that $100, $100 or less after you apply that financial help. Okay, per month.
Per month. Okay, so after you apply the subsidy. So then you can get plans for how much you're going to quiz us, right?
Well, sure. Here we go. So if 80% of those people on the marketplace purchased plans and they were getting financial help to pay for those plans, their premiums would cost on average less than $200 a month, less than $150 a month, or less than $100 a month.
I'm going to say 150-ish.
I'll go 100.
$100 or less on average.
Okay,
yes. Because you're getting the help to pay for those premiums, so your responsibility as a member ends up being, on average, less than $100. So there are really affordable options out there.
And reasons to act. I mean, not to procrastinate here.
Absolutely.
So your event is when? Give us the details so everybody knows.
Absolutely. The event is this Friday and this Saturday. We're going to be at Fairlane Town Center from 12 p.m. to 7 p.m. We'll have dedicated agents there. Agents cost you nothing to get their expert advice, and they can actually answer questions, walk you through the enrollment right there on site.
That's awesome.
Well, good to have you, Sean.
Thank you so much.
Great information.
Well, that was fun. We'll be right back.